Hi everybody, Dr. Kaylee Simmerman here, owner and founder of the Hope Doctor's Pelvic Floor Physical Therapy, where there is a holistic ortho-pelvic experience waiting for you. Are Kegels the only thing that is going to help you? Are Kegels the answer? Are they the best thing to do? That is the top question for today's video, and I would say probably the top question that I still get asked as a pelvic floor physical therapist. And I used to get frustrated about it, but the more I think about it, the more impactful it is for us to have these conversations and to continue having this education, because how are we supposed to know if there isn't good, effective, impactful education out there? So first and foremost, let's just talk about reasons people may try to do Kegels for first. So things that might be considered like a pelvic floor dysfunction. So that would lead you to do a search on what do I do about this? Or, hey, this is an issue. Is this normal? What can I do about XYZ? Those kinds of things are if you're starting to have pain with intimacy, if you are starting to leak urine, if you're having extreme, excessive, consistent constipation, aka we call that recurrent or chronic constipation. Those are some things that are also contributing to pelvic floor dysfunction that we don't always think about. Other things are like pelvic organ prolapse, diastasis recti. Even during pregnancy, there might be some symptoms like round ligament pain, pubic symphysis pain, pain with intimacy, pain with certain postures or positions, difficulty lifting weights, even going into just pregnancy care, postpartum care. So like these are reasons that you may find yourself like, hey, is this normal? And you would search for an answer to that, right? Like just like we all would. We would all want to go onto Google, onto YouTube, and find an answer for that. And so what's gonna happen, and you'll notice this pretty frequently, is there's like two sides of the pendulum now. You're gonna notice that either A, you're gonna go to a general pelvic floor physical therapist, you're gonna find a program online, you're gonna do some research, and you're gonna get told somewhere to do Kegels. If you go to a person in person, they typically will hook you up to things like electrodes. You'll be able to see it on the computer screen where when you contract the muscles, then you'll be able to see it go up. When you relax, you'll see it go down. That's typically kind of what they're doing when they are educating you or providing you with the opportunity to do Kegels for the symptom that you called them for. And so when you do that, or you find online that you want to do a Kegel XYZ, a lot of times clients will actually do the program, whether it's like, I saw something ridiculous the other day that was like, do 500 of these a day, or do 300 of these a day. And like, you're gonna find that a lot of times the Kegel is actually gonna make your symptoms a little bit worse. Or the second issue that I find with this is that you don't actually know what you're doing or how you're doing it, right? Like, because there's so many ways to compensate when we're doing a Kegel. So that's one side of the pendulum, are the practitioners, the programs, the things online that are still prescribing Kegels as like the end all be all, like, hey, you have to do these, and you have to do this many, and you have to do them at the stoplight, and you have to do them when you're brushing your teeth, and when you're walking, and when you're doing things. That's one side. The other side is never do a Kegel ever in your life. It's not important. It's not an isolated thing that we do. It's not functional XYZ, right? So like then you have the other side of things where it's like a holistic approach. We look at everything, but we ignore prescribing Kegels. We don't give you Kegels as homework. We kind of ignore that as an aspect. And there's a lot of pelvic floor therapists that actually practice over there. The Hope Doctors, we understand the benefit of being able to do that pelvic floor contraction. So what is a Kegel? A Kegel is where you're able to take the muscles between your legs and you're able to lift up or contract the muscles. The way that I educate somebody of doing it is like pretending that you have a straw in your vagina, and I'll talk about a male pelvic floor in a moment, but pretending like you have a straw that's in your vagina. And when you're doing a Kegel, you're thinking about closing off the muscles around that straw that's gonna suck up the milkshake or the smoothie that's in the cup that the straw is in. But you're doing that with the muscles around the vagina. We're not kicking in the butt muscles, we're not kicking in the lower abdomen muscles, we're not kicking in any other muscles. It's just those muscles to do that Kegel. You can like even further that to knowing, am I doing a good job closing off around the anus? Am I doing a good job closing off around the vagina? Am I able to do both, but am I able to do one without the other as well? Like it's really important that we do that, right? And then you get to the other side where we're talking about male pelvic floors, and when male pelvic floors with external genitalia, When I am educating you on how to do a Kegel, you oftentimes do best with a visual cue. So you are looking at yourself in the mirror where you derobe, there's no pants or boxers, underwear on, there's nothing on. You're looking, and when you inhale, nothing's happening, but when you exhale and you close off the anus, so you are thinking about the anus around the rectum, there's that straw, right? We're thinking about sucking something up and in through the straw. You will see the genitalia, the external genitalia, penis, scrotum, those things will lift up. You're gonna see that visibly. So doing a Kegel, that's what it is. And why would someone prescribe it? So like the old school of thought is that we would utilize Kegels to decrease leakage because you want to keep the urine in, decrease pelvic pain because you probably don't have good strength, decrease prolapse symptoms because things are falling out. We instinctively need to hold them in. But it's so much more than that. There are so many more factors that can contribute to pelvic floor dysfunction. There's rib cage, there's thoracic spine, there's jaw health, there's foot health. There's all of these different things that are really, really important for us to understand the importance of why we would assess a Kegel, why we would prescribe them, or why we wouldn't. And so a Kegel is just a teeny tiny piece of an assessment. And if you're seeing a pelvic floor therapist, it's really important that you are not only there to do Kegels, right? And that's not the only assessment that they do. With pelvic floor therapy, you should be getting a full body assessment. Let's say you come in because you're leaking urine. If your pelvic therapist, and let's say you're leaking urine when you see your house when you're driving home every day. If your pelvic floor therapist is only checking your pelvic floor, like you get on the table, derobe, they do the internal assessment, they have you do some Kegels, they give you some for home, they tell you to do it at the stoplight, or they add like contraction, or they tell you like what to do with like biofeedback, or you're doing an online program and you're doing Kegels and doing connection, right? If that's it, if that's like baseline, you're not getting the care that you deserve. That is not what pelvic floor rehab is. Pelvic floor rehab is taking a physical therapy approach and a background of orthopedic education, bringing it in and tying the pieces together to implement the pelvic floor. It is more than that. You should be able to see, what does a squat look like? How is it impacted when you get to the bathroom here? What happens when you pee? How long are you peeing? Are you able to close it off? Are you able to open it? Are you having good coordination? Do you have good length? Is there pain? All of that. So when we're thinking about like the Kegel, for example, I use a Kegel as an assessment tool. I do think it's important on one side that you're able to do one. It's very important that you can feel it, that we're not compensating at it, that we use the proper muscles, and that we're not using all the other muscles, that we don't hold our breath. It's very important for the ability to do that, because if you can't find your pelvic floor muscles, of course we're going to have pelvic floor struggles, right? It's important to be aware of those muscles, where they come from, what's going on with them, and what's contributing to your issue. So that's one piece of it. But I'm also using the Kegel to assess coordination and length, because it's not only about your ability to close off the pelvic floor. We also need to lengthen your pelvic floor, because a muscle cannot stay here forever. It also cannot stay here forever all day. It needs to be able to move between the different motions. So we need to have a contraction or a strength, and we also need to have that length and relaxation factor occurring. And so it's important that we're assessing that, and that we're also assessing it under different stressors, like fast. Can you squeeze and let go fast? Can you do that while I ask you to relax, does that actually contribute to you relaxing? When I ask you to contract, does that actually contribute to you contracting? What I mean by all of that, I'm using that as an assessment tool, a theory, in order to guide me into what's actually causing the issue. So if you're leaking when you see your house, a Kegel is not going to change that. We're not going to be able to do 5 Kegels every day for the rest of our life and recognize that that's never going to cause a bladder issue. It's just not going to happen. I don't care who you are, like that's just not going to happen. A Kegel is not going to be the answer to everything. Will it improve some things? Maybe, if there is true weakness. But what we found, and what I've found over a decade of experience here, is you often don't have a strength issue. It's a coordination issue, because when you're standing, your pelvic floor is going to activate, it's going to control, it's going to do the things. It's more so, when are we using it? Are we using it appropriately? Are we getting the right muscles? Are we not getting the right muscles? Like, what are the things that we need to be paying attention to that's going to impact you more and improve and get rid of the actual symptom itself? Like, what's that root cause? the Kegel is not going to be the thing that is going to change your pelvic health care. It's just not going to happen. That's just not how it works. And so, because your body works as one, everything impacts everything else, right? And so it's really important to understand that Kegels are not always the answer. They're not the answer always, right? Like there's always so much more than that. I can't remember the last time that I prescribed a Kegel as an exercise without it being like a breath coordination situation or a certain type of like coordination with pressure management. Like it's just not something that is effective. It doesn't work. And so we're moving away from the school of thought that Kegels are the answer to everything and moving into a world that's it's so much more than Kegels. Like, yeah, it's just important to be able to do them. And there's so many other layers to that. And so is a Kegel the answer? No. I don't even have to say it depends on that because there's always going to be other factors that are going to benefit because everything impacts everything and you have one body and it's all connected. And so it's important that we're able to do them. It's important that we're able to find the muscles. It's important that we have good coordination and there's more to it. So hopefully that kind of clarifies a little bit of that, but I'm open to any questions, concerns, and thoughts in the comments below, and I look forward to our next video.